Hi, I'm Charlotte Moser, the co-director of the Vaccine Education Center at Children's Hospital of Philadelphia. And today on VEC Vaccine Notes, we're going to be talking about shingles. Often when we hear stories of somebody's experience with shingles, they describe not really having too much of a concern when their first symptoms appeared. They might describe a vague itchiness or a single blister or spot, maybe a feeling of something in their eye. But they're sharing their stories because of all that followed those initial symptoms. Things like debilitating pain, damage to their vision, or an inability to complete normal daily activities. Really a removal from their life for some period of time. And for some of them, never really returning to that pre-shingles life. In fact, the pain from shingles has been described as some of the worst in medicine. But there is a vaccine that's recommended for everyone 50 years of age and older in the United States. It's remarkably effective at preventing this suffering. During the next little bit, we'll talk about shingles disease, the vaccine that prevents it, common questions we get here at the Vaccine Education Center, and the relative risks and benefits of the disease and vaccination. So let's get to it. Shingles is caused by the same virus that causes chickenpox. When people are infected with chickenpox or virus, or when they're vaccinated against chickenpox, some of that virus will linger silently in cells of the nervous system. And if it reawakens, it can cause shingles. That happens sometimes when people have weakened immunity or even as they age, because as you know, our immune systems get weaker as we get older. The most common symptoms that occur with shingles are a rash that typically develops along a nerve path and severe debilitating pain. This pain can last for months or even years and be so severe that people lose sleep, experience depression, weight loss, or anorexia, and even are unable to complete basic daily activities like dressing or bathing. Some people stop participating in normal social activities. And in rare instances, the pain has been so severe that it has led to suicide. About 15 of every 100 people with shingles will develop blisters that are near their eye, and that can result in reduced vision or even blindness. Other complications of shingles can include scarring and bacterial infections that occur where the lesions are located. Because shingles occurs when a virus that is in a person's nervous system reactivates, 2 points are worth mentioning. First, you can't get shingles from somebody else with shingles. However, and this is a big however, someone with shingles can spread the virus to a person who's not immune to chickenpox. That person can go on to develop chickenpox. This becomes relevant particularly for infants who are too young to get vaccinated against chickenpox, and that vaccine is normally given around 1 year of age. With this said, the virus is only spread if the person who's not immune comes into contact with the liquid from the blisters. So if somebody with shingles keeps their rash covered while they're around this unimmune person, the chance of spreading the virus and causing chickenpox is lower. The second point is that anybody who had chickenpox is carrying the virus around with them. And as I mentioned, because as people age, our immune systems become weaker. So if people have stress or an illness or they're getting medical treatments, this virus is an opportunist, which means it'll take full advantage of that weakened immune system to start replicating. And that's why vaccination is important, because it reminds their immune system about this virus that's already in their body. So now let's turn our attention to the vaccine. There's currently one shingles vaccine used in the United States. It's called Shingrix. This vaccine contains a single protein from the surface of herpes zoster virus. The vaccine also contains 2 adjuvants. One is called QS21, and it's made from the bark of the Quillia saponaria tree. The second is a detoxified lipopolysaccharide taken from the surface of bacteria, and it's known as monophosphoryolipid A. Together, these 2 adjuvants improve the immune response in adults. Now, this was an important advance in preventing shingles because the first shingles vaccine, which was called Zostavax, used the same live weakened virus that's given to children in the chickenpox vaccine. But in order for adults to be protected, The shingles vaccine version had to contain 14 times the amount of live weakened virus that the chickenpox vaccine did. So the new vaccine not only helped generate better immune responses in adults, but it also decreased the need to use the same live weakened virus for both the chickenpox and shingles vaccines, which, given the large quantity of virus needed for the adult version, was a really important improvement. Now, the shingles vaccine that we use in the United States today protects about 9 out of every 10 people against shingles. It can cause some mild side effects like pain, redness, and swelling at the injection site, and some people can also get systemic side effects, things like fatigue or fever, headache or body aches. Some people even experience shivering. But those are short-lived side effects. People 50 years and older are recommended to get 2 doses of this vaccine, and those doses should be separated by about 2 to 6 months. So now let's turn our attention to some of the questions we get here at the Vaccine Education Center. Sometimes people who have shingles wonder if they can be around their grandchildren who haven't yet been vaccinated against chickenpox. The short answer to this question is yes, but we should dive in a little bit, because they should make sure that the child doesn't come into contact with the rash. Because the rash has virus in it, it could spread to the child. But if the rash hasn't yet developed, or if it's crusted over, or even if the person has lingering pain but the rash is gone, they're not going to pass the virus to the child during any of those periods. Now, we also get questions about whether people who are recently vaccinated against shingles can be around babies who weren't yet vaccinated against chickenpox. And again, this answer is yes. Since the vaccine that we use now is only made from a single protein of the virus, it can't cause chickenpox. The same was not true with the older version of the vaccine, which contained the live weakened virus. And then in that case, it was easier to spread if the vaccinated person got a rash. But that's not something we have to worry about with Shingrix. Sometimes people contact us and wonder should they get the current shingles vaccine if they had the older version. And the answer to that is yes, simply because this one induces better immunity. Likewise, some people ask whether they should get the vaccine if they've had shingles. And again, the answer is yes. And that's because about 5 of every 100 people will have shingles more than once. People also ask if they should get vaccinated if they don't remember having chickenpox. And again, the answer here is yes, too. But it's generally assumed that people over 40 were exposed to this virus, even if they don't remember having chickenpox. And that's why in this case, they're still recommended to get the vaccine. Sometimes people wonder if a person who had the chickenpox vaccine can get shingles. And again, the answer here is yes. And that's because the chickenpox vaccine contains that live, albeit weakened virus. But what's important to know here is that studies have demonstrated that when people get vaccinated against chickenpox, they're less likely to get shingles compared with people who had a chickenpox infection. And if they do develop shingles, it tends to be much less severe compared with somebody who had chickenpox infection. A newer question that we've been getting is whether the shingles vaccine decreases the chance for dementia. This question has come about because there's a growing body of evidence that suggests the shingles vaccine can decrease the number of cases and severity of dementia. Now, these data are emerging, so we still have to learn more. For example, it's unclear by what mechanism this might be occurring. Some people think it could be explained because shingles has been suggested to be a cause of dementia, and so simply by decreasing the number of cases of shingles, we may also be decreasing the number of cases of dementia. But other theories exist as well. For example, one theory is that the vaccine could be protecting recipients against a more generalized inflammation of neurologic tissues that can occur in older age. And other people think that it could be possible that the vaccine is having an effect on something called immunosenescence, which is a condition in which the aging immune system becomes less effective, leaving older people more susceptible to infections and health conditions that the immune system previously protected against. Now, 3 other points are worth mention related to this question of whether the shingles vaccine could be decreasing the chance for getting dementia. First, The effects have been more pronounced in women than in men. Second, in at least one study, the effects were apparent for both the current and the previous shingles vaccine, but they were more pronounced for the current vaccine. And third, some of the studies have suggested that the vaccine may delay, but not actually prevent the occurrence of dementia. Given these considerations, at this point, we recommend thinking about this as if the vaccine might offer benefits beyond preventing you from getting shingles, but your decision should not be to get the vaccine because you're trying to protect yourself against dementia. We still need more information. So let's finish up with a look at the relative risks and benefits. Today we talked about the fact that while people generally don't die from shingles, the pain can linger and be so severe that people are unable to participate in daily activities and regular socialization. Likewise, people can be left with scars, reduced vision, or bacterial infections that occur at the site of the lesions. We also talked about the fact that virtually everybody over 40 years of age has this virus living in their nerves, which means it can reactivate at any time. It's not like most other diseases that spread from an infected person to a susceptible person. However, people can spread the virus to babies who have yet to be vaccinated against chickenpox, and that can cause them to get chickenpox. On the other hand, the vaccine causes some injection site reactions, and it can also cause some systemic effects like fatigue, fever, headache, body aches, or shivering, but those are generally mild and short-lasting. For these reasons, when our team looked at the relative risks and benefits of the shingles vaccine, we determined that the benefits outweigh the risks of vaccination. And we hope that after you've considered this information, you'll feel that way too. Thanks for listening today.